Thank you again for coming for this, what is now annual, I think, fourth year that we're doing this. My name is Gregory Vidal, and thank you for showing up for this primary care oncology conversation for change. I am honored to chair this program again. I am thrilled to see so many of you here. I do see some familiar faces. We do want to also remind you that on Thursday, April 2025, we have a breast cancer GI update that we'll also be doing. And you guys are all welcome to show up and support. No, we do have some housekeeping that Miss Ashley is going to go through with you.
Good morning, everyone. Just a few housekeeping notes. First, you all should see the program at your tables for just like the sessions and all of that we're going to have today. And then next, throughout the sessions at the end, if you all have like any questions, just feel free to raise your hand. We're going to come over with the mic. And then please just wait till you get the mic just so everyone can hear you as well. And we're also having an exhibitor bingo like raffle. I know some of you already filled it out and turned it in, but that's a chance to win a prize at the end of like all of the sessions. And then lastly, if you all like need any assistance or anything like that, the registration table is where you'll go. But we're going to start off with Genentech, and I hope you all enjoy the program.
Thank you. I wanted to run up here, but I knew I'd trip. So that's fun. But thank you, everybody. I'm Megan from Genentech. I flew out from San Francisco. It's always so great to be back in Tennessee, especially at this event. And I was really excited to see biomarkers were on the list. And my full-time job is improving representation in clinical research, and just so honored and privileged to work with West Cancer Center in the Advancing Inclusive Research Site Alliance, where they're teaching us how to listen better and be better at reaching our patients who are most in need. And just wanted to tell you a quick story, just emphasizing the point of how important it is that we're all here today as a community to help our patients. I have a very close friend. She's actually an oncologist, and she ignored her symptoms for 3 months. So it's just like, this can happen to anyone. Someone with the most privilege, insurance, medical knowledge, and she was bleeding. She thought it was IBS. She self-diagnosed, and she was in such pain. She went to the emergency room last week, and they imaged her, and her abdomen was full of tumors. And then they got her in. She's very lucky. She thinks she's very lucky. She got into surgery Thursday, 7 hours, removed the tumor, nothing visible left. And I've got her text in front of me. She was so thankful that they found something that was actionable that could be targeted. And I know the researchers in this room have made this possible for us to have treatments that can cure people that could not have been cured, 5 to 10 years ago. And the importance of that research, and then making sure everybody's tested and making sure biosamples are representative. If you haven't heard of all of us, they'll do free testing for anyone so we can improve the representation and the diversity of those biosamples so we can find more actionable biomarkers. But she said, and who would understand this, right? But the physicians in this room, tumor is mismatch pair deficient in 2 of 4 genes, MS1, MS12, MS16. That means I might have checkpoint inhibition that can help me. And 2 to 3 tests are positive for estrogen, IHC 2 to 3 plus for PR progesterone. Maybe hormonal therapy like tamoxifen can help me. She has hope. She has hope that her residual cancer can be taken care of because of this biomarker and this targeted treatment. And community members like you, whether you're from oncology, primary care, other healthcare providers, that help explain this to your community members and understand the importance of even going to your primary care physician who can help you sooner before, you have someone who's walking into the ER and getting diagnosed. And I say this especially because I know, and she knows, she's very privileged And despite that, she delayed. And then our folks who are uninsured, who I know, I was just having this conversation over here, that you treat a fair number of people that are uninsured in the community. And it might get harder given some of the anti-science sentiment we're seeing out in the public. And it's going to be all of us that are out there helping our patients get treatment sooner and get targeted therapy. So I'm so excited to hear what is going to be shared today, because I know it's the latest. And we're going to be armed to really help those most in need. So thank you all for coming on your Saturday and being champions of this work.